on va retourner sur le côté positif du bord de mer, hein, parce qu'avant toute chose, quand même, la mer nous apporte beaucoup de choses à la santé. Et nous avons le plaisir d'accueillir Mathew White, le docteur Mathew White, qui travaille au Centre européen de recherche pour l'environnement et la santé humaine. Donc il étudie la relation entre l'environnement et notre santé, et il a réussi à avoir des données très intéressantes sur l'impact de la vie en bord de mer, hein, un séjour ou le fait d'habiter en bord de mer, sur la santé et sur le bien-être. Donc je lui laisse la parole et je vous demande de l'applaudir.
Bon, mais merci beaucoup Guillaume pour m'inviter. Je suis désolé, mais mon français, ça fait 20 ans que je n'ai pas parlé français, alors la plupart verra en anglais, mais j'ai essayé d'expliquer mon recherche un peu en français où je peux. Ok. Bon, je suis un psychologue, je ne suis pas médecin, et j'étude pour la plupart bien-être. Ça veut dire quoi exactement, le bien-être? Il y a beaucoup de gens croient qu'ils comprennent bien-être, mais pour moi, c'est les émotions, surtout, comme psychologue. Bon, un petit expériment. Imagine, s'il vous plaît, que vous êtes en vacances, vous arrivez dans un hôtel, il y a 3 chambres qui restent. Les chambres sont identiques, sauf le vue de la fenêtre du balcon. Ouais. Quelle chambre voulez-vous, hein? A, B ou C? Nous avons demandé à un % de gens en Angleterre, et naturellement, la majorité, ils ont des B. Et ce qui est important, ils payaient plus, 100 ou 15% plus. Pourquoi? Les gens, ils ne sont pas stupides. Hein? Ils seulement payaient ce que pour avoir un retour. Et moi, je crois que le retour, c'est de bien-être. On payait, c'est quoi? C'est 12 livres pour le bien-être. Le vue, ça fait 5-10 minutes. La plupart, on est en bas ou en dehors, ou ça, sont 50 minutes, peut-être 50 livres. Alors, en Angleterre, peut-être pas en français, je ne sais pas, on a deux gros problèmes de santé, obesity, grossesse, je crois, en français, et problème avec bien-être. Ici, le problème, le premier, c'est pas peut-être aussi grand ici en France qu'en Angleterre, mais c'est ce que on essayait et voir si le temps à l'océan peut être amélioré, disent deux choses en cas du médicament. Ok. Hier, Jean-Luc Ménochet, il y a un très intéressant talk de thalasothérapie ici, en Pays Basque. Voilà, c'était très intéressant. En Angleterre, ça fait 250 ans avec le Dr. Richard Russell. Ils ont un livre, Dissertation sur Seawater, et ça fait 250 ans que nous avons des hôpitaux in Margate pour thalassothérapie. Eh bien, pour 200 ans, les gens, ils marchent aux côtés de la mer. Le promenade, c'est un mot français qu'on utilise en Angleterre. Promenade, c'est bon pour la santé. Bon, les gens, ils ont pensé ça pendant longtemps. Maintenant, c'est ce que nouvelle, c'est que je crois que notre recherche scientifique, on utilise plusieurs méthodes, analyse des populations totales en Angleterre, expériments en place, en situ, expériments pour notre laboratoire et tous. Et je parle aujourd'hui un peu de ces choses. Alors, la Côte et la Santé. Est-ce qu'il y a des évidences? Bon, on a commencé à décider avec le census, ça fait les adultes en Angleterre, 48 millions. Eh bien, quand ils se habitent, c'est loin auprès de la mer, ok? Et le bien-être et la santé. Studies, c'est la santé, ça correlates avec 40-20% avec le vraiment les médecins dit que ça c'est la santé. Et alors, ça c'est le résultat. C'est trop dur en français, je dois en anglais? Okay. Yeah, okay, my French isn't so good, I'm sorry. Okay, well, I'll try in English then. My English isn't so good either. What you see here on the y-axis is the change in health status compared to those people who live 50 kilometers from the sea. That's the reference category. And what you see here is at 1 kilometer, you get the healthiest population. And that decreases as you get further and further inland. So if you look at the figure here, you can see it's an improvement of about 1.5%. So we're not talking massive differences here. On average, they're about 1.5% more likely to be in good health than people who live inland. But what you see is this lovely gradient. So the further inland you live, the lower your health. There's also a very important thing that came out of this that we were able to do because it's the entire population of England. We structured it by different communities, and what we found is that the poorest communities show this effect the strongest. It's not the rich people. They go on holiday to Biarritz in England, right, or wherever. So they get their dose. It's the people who can't afford to go on holiday or don't have a car that benefit most from living near the coast. You could say, well, it could be that the richest people, the healthiest people, they already live at the sea. This is just a cross-sectional study. But fortunately, in England, we've had a panel survey which asks people for 12 years, 18 years it's now, how healthy are you, along with other things, every single year? And there's 12,500 people. The beauty of this longitudinal study is that some people move house. So they move closer to the sea or they move inland. And what we're able to do is monitor the health of the very same people over this 12-year period. And what you see is that when they're living near the seaside, when they're living near places where I live in Cornwall, their mental health is better, as measured by the General Health Questionnaire, their Bien-être. Their physical health is also better when they're living within 5 kilometers of the sea. So it's not a cohort effect. It's a longitudinal change and improvement as people move to the coast. So the bottom line is it's not just people are healthier who live at the sea, the same people are healthier in years when they live at the sea. This isn't just a retirement effect. In England, lots of people retire to the coast when they finished working. If we do this analysis ignoring the retirees, we find exactly the same effect. So most people in this audience, I guess, aren't retired. You would still see the effect in that population. Why is this? Well, there's several theories put forward, and you've heard some at the conference in the last 2 days. We're using some very simple, very prosaic mechanisms. Yesterday, 2 days ago, the British Medical Journal published an article reviewing 200 studies and concluded that basic physical activity is as good for a whole range of problems such as heart disease and stroke as taking a regular walk, as medication. So we know that regular exercise is extremely good for your health, often better than any pills you could take. So the first thing we looked at is, do people exercise more at the coast? There's a survey called the Monitor of Engagement with the Natural Environment in England. It has 142,000 people. They ask 1,000 people every week for 3 years, how often do you visit different natural environments and what do you do there? And this enabled us to look at the amount of activity people were doing per week. Now, on the y-axis, this is the odds ratio that people will meet the government guidelines. Now, in England, that's 5 times 30 minutes a week. So 150 minutes activity a week of moderate intensity, fast walking, light jogging, going on a bicycle. And it's the same story that I showed you earlier with health. It's a slightly different distance, it's miles, not kilometers. But you can see here that you're more likely than the reference category over here to be doing exercise 5 times 30 a week, and you also see it declines over time across distance. So basically, people who live near the sea do more exercise. Well, that's no great surprise walking around here. I was here on Thursday evening, amazing evening with this beautiful thunderstorm. There were people walking everywhere. In the middle of the city, whether people are walking around enjoying this view, I doubt very much. So it's not complicated. The sea attracts people to do exercise. But those are just big numbers, so we've done lots of different studies. We interviewed 40 families, both for parents and children, to say, well, what do you do when you get to the coast? And obviously I'm not going to go through all of the detail here, but these are a couple of quotes from a mother and her son about what happens when they visit the coast. This is the mother speaking. They just love the space on the beach, you know? You just see kids come alive. They play and just jump in the waves and start running up and down. So what we're doing at the moment is we're fitting children with accelerometers, just here, and we're going to monitor how much physical activity they do when they visit the beach, when they visit a park, when they're running around in the countryside. Because we've got some ideas that for some reason the beach and the coastal areas encourages physical activity. I'm not talking about swimming here. I'm just talking about running around on the beach. And the little boy, her son, made a very, very interesting observation. He said, instead of the adults just sitting somewhere on a bench while the kids do activities, they get up and they play frisbee or cricket or football or sometimes go swimming with them. So what the child is saying here is that the parents are acting like children. How often do you run around playing football, frisbee, and all the rest of it? Well, probably not very often by yourself in a park, but you go to the beach with your children and you do it. So what you can see is that people are living near the beach. They visit more often. We've got plenty of data on that. 50% of all visits in the UK to the coast are made by people who live within 2 kilometres. So they visit more often and they're more physically active, and we know that physical activity is related to health. There are other things we're looking into, cognitive development of children and so on as a function of play, but I'm not going to talk about that today. The other main mechanism we've been looking at, again, very simple, is stress. Modern urban living is littered with opportunities to make us stressed, and going to the beach is a chance to unwind. So we've also been looking at data, or large-scale population data, on the levels of stress in relation to visiting the coast. And of course, I must apologize, all of this data is about England. I would love to do similar research in France and other countries. I got contacted by some very worried people in Switzerland recently who said, we don't have a coast, is that a problem? So I don't know. I'd also be very interested to see the interaction with large lakes, for example, or the mountains. Okay, back to our data. So another part of this survey from Natural England asks particularly 11,500 people, when you went on your visit, how refreshing, revitalizing, calming, and relaxing? Basically, how stressed, reduced do you feel? Now, each dot on the map, we've plotted this, is a specific visit. So you have red visits here. These are in towns, that's London. You've got Manchester, Birmingham, and so on. You have green dots, and they're by the countryside. So this is classically moorland or woodlands. And you can see the blue dots around the coast. So these are visits to the coast. And what we were able to do with this map is work out how people felt on each of these visits. And here's the data. So over here on this side, you've got the 3 categories. The reference category is countryside. And what you find is that going to an urban park, a public garden, as you'd say in French, is significantly less stress-reducing, but visiting the coast is significantly more stress-reducing than visiting either of these 2. Now, this includes all activities, 11,500, but of course you can do different things at the coast. You can build sandcastles, you can play frisbee, and so on. So we just looked at the main activity, which about half the visits, people just said we went for a walk. And you can see that over here on your right side. We see exactly the same pattern. There's a slight reduction overall, but exactly the same pattern. So even going for a walk along the sea seems to be better at reducing stress than the alternatives. Okay, but this is big population data. I'm in a medical school and we're using different techniques to try and understand stress reduction. So we got 28 participants and we put them in an fMRI scanner, you know, the thing that you measure blood flow in the brain, to try and understand what was going on in the brain when we presented people with pictures of the coast over here versus very equivalent pictures without sea. And we used a whole block design. I'm not going to go into it now. But what I'd like to show you is the differential activation in particularly the right, but also the left hemispheres when people are looking. This is the aggregate across 28 people, across all of the water images, when they're looking at this coast versus not the coast. So what we have here is a number of activation areas. But if you follow the crosshairs, the lines here, this is the main area that's standing out when you see water as opposed to not water. Oops. Okay. Now what we know is that's called the caudate nucleus. It's in the right hemisphere in this case, on average. Now this area is associated, basically a number of things. One must be very, very careful with interpreting fMRI data. You can read all kinds of things in here. It depends on the significance level and so on. But we believe this is what's going on. It isn't published yet, so I'll add a note of caution to that. But this is where we're at the moment, when we're getting it scrutinized by a number of professionals in the field. But this area, the right caudate nucleus, is associated with strong attachment. So classically, when you see a picture of your mother, for example, this area lights up. It's associated with approach behaviors. So basically, it's something, when you see this area light up, it means the person likes it a lot, and they're willing to approach it. They make these psychological approach movements. Now that's really fascinating, and it makes sense, because if you remember our first study, where I asked you which hotel room you would like, basically willing to visit or willing to pay is an approach avoidance. So what we're seeing here is that the brain is lighting up in an area exactly the same as we find in the respondents to the questions, which room would you like? They'd like the one with the coast. So this isn't, it's very impressive, these pictures, but it's essentially what people are saying in questionnaires as well, which gives us concordant validity. Okay, so viewing water leads to this liking approach activation, particularly the coast. As I said before, I work in a hospital, so we're not just interested in getting people out active on the coast, we're interested in bottling the coast and bringing it indoors. How can we use this in therapeutic contexts? And we've been using all kinds of things, sounds and images and so on. But I'll just quickly give you some outline of a study we've been doing. Over here, we've created a virtual world. Actually, it's a real world. It's a beach near where I live called Wembury. And we have a computer expert generate a whole world you can walk around in, just like one of these video games, for about half an hour. So what we've been doing is we've been having people in a dental surgery. The study is ongoing at the moment. It's a randomized control trial. And they either get to walk around on the beach while they're having a dentist treatment, or they get to look around the normal dentist room, or they get to walk around a town, so that a virtual town, so we can compare beach with the town. But this is that study's ongoing. We don't have the full data. But in order to get permission to do that, we had to demonstrate proof of concept in the laboratory. It's a little bit difficult inflicting pain on people, but there is one way you're allowed to do it, and that's what's called the cold presser task. Basically, you put someone's hand in a bucket of very, very cold, icy water, and it's painful. I'm not very good at it myself, but it does hurt. And the idea was, how much does this hurt after 2 minutes while watching the beach versus while being in the normal dental surgery? And the results are quite surprising. So here we go on the y-axis. You've got pain up here. It's 0 to 10. So 8 means it's extremely painful. It's very uncomfortable. And this is the classic condition. If you see the virtual beach, it's still painful, right? It still hurts, but it hurts a lot less. And over here, this is really important. What we did was we phoned the people up a week later and said, do you remember when you stuck your hand in the icy water? How painful was that? And these are their memories of what happened a week ago. And what you can see, of course, is that overall pain has gone down. We forget how painful it is. But the gap now between the dental room and the virtual beach is even bigger. Why is that important? It's important because when you make your next appointment to the dentist, a lot of people cancel them because they're worried about the pain they're going to experience. But if you can't remember how painful it was, you're more likely to make the appointment and you're more likely to get better dental experience in the long run. Okay. So those are our two main mechanisms that we think are underlying the link between exposure to coast and the health through exercise and stress. But ultimately, another aim of ours is to reduce the amount of pharmaceuticals in the environment and the amount of pharmaceuticals that people are ingesting. As I just said, the British Medical Journal has just concluded that physical activity is just as good as the pills people are taking. The trouble is, of course, many of the pills you take are not metabolized in the body. They pass straight through you. And as you heard earlier, straight into the water system and straight out into the sea. So there's all kinds of pharmaceuticals now being found in the sea. And if we're consuming less, we have less of a problem of what they're doing in the environment. So another aim through all of this is, can we reduce the amount of pharmaceuticals people are consuming? Okay, so just to run through the take-home messages again. At least in England, people who live near the coast are healthier. That's not because of differences in people. The same people are healthier in the years when they live near the coast. In part, we think this is because it encourages exercise, even simple exercise like going for a walk. And also because there's a reduction in stress. The exact mechanisms of stress reduction we're currently researching. I showed you a little bit about the neurocorrelates approach through the brain scans, which confirms what we're seeing in the other photographic studies in the laboratory. And what we're trying to do now is bottle the benefits of the sea, so we don't have to take people out there, we can bring them into the hospitals and so on. There are many, many remaining questions. What about France? I have no idea. It would be really, really interesting to research that, and various other countries. What's the optimal dose? If we're really going to compete with medicines, and if clearly I'm not talking about antibiotics and so on and so forth, there are a whole range of extremely beneficial medicines. But are there some cases where we could substitute medicines for these things? How often do I need to be by the sea? How long for? How long do the effects last? Do I need my daily dose of 15 minutes a day? Can I have a 3-week holiday once a year? We've no idea. Absolutely no idea. There was a very interesting comment from Dr. Sylvie Perez-Pierrot earlier, and she said the problem with the chemicals is a tiny little bit every day. And I think this is the benefit from the coast. It's not massive. It's a tiny little bit every day that accumulates. So it's the exact inverse, if you like, of the chemical problem. So it's a real balancing act. At the one point, you're exposing yourself to all kinds of pathogens. On the other hand, sitting in front of the television at home, you're likely to die 5-10 years younger from diabetes. So, you know, which one are you going to go for? I have 2 PhD students working on the effect on children, because particularly at this age, as we saw earlier, running around and so on may be very important for children. And what's the environmental impact? Say we prove, that's a strong word, but say we show that spending time at the coast is good for your health, more people might go to the coast. I saw some photos of Bien-être today and yesterday where there were literally like 10,000 people down there. That doesn't seem very stress-reducing to me. That seems pretty stressful. So there's going to be a trade-off between encouraging people to spend time at the sea and the negative impact it might have if you encourage lots of people. There's also going to be huge traffic delays. So sat for 4 hours in a car is really not good for your stress either. So how do we manage those things? How do we organize public transportation so that we can get people to and from the benefits of the sea without increasing their stress? And we are yet to start this kind of work of comparison with antidepressants, for example. That's the next step. Okay, well, thank you very much for your attention and following me in my bad French and my strange English. And I'd just like to acknowledge it's a big team, right? This isn't just me. These are all the people I work with in the UK, and it's really important that we've all been involved in this research. Thank you very much.